Which among the following food items need to be avoided by an immunocompromised person who is experiencing frequent diarrhea? Milk, rice water, fruits, or curd? And here the right answer is option A, milk. The normal range for ALT test result in men would be found in between 10 to 40 international unit per liter, 40 to 70, 50 to 80 or 70 to 100 international unit per liter. And here the right answer is option A, 10 to 40 international unit per liter. Serum alanine aminotransferase or ALT is the most common and economical screening test for the assessment of asymptomatic liver disease. Most laboratories in India mention the upper limit of normal for ALT as 30 to 40 IU per liter. Drug of choice for gout is phenytoin, allopurinol, diazepam or methylprednisolone. Drug of choice for gout is allopurinol. Allopurinol is an antihyperuricemic which prevents the production of uric acid. So, allopurinol is used to prevent gout attack. Non-steroidal anti-inflammatory drugs and colchicine are best for treating the inflammation and pain during a gout attack. Question number 4. Position used while inserting NG tube or nasogastric tube is supine, high Fowler, low Fowler's or orthopnic. And here option B, high Fowler position is the right answer. High Fowler's position facilitates the entry of tube easily, so it is the indicated position. Dose of streptokinase to be used in MI is 0.15 million units, 1.5 million units, 15 million units or 150 million units. The streptokinase to be used in MI is 1.5 million units. Most common cause of left-sided heart failure is septal defect, congenital heart disease, coronary artery disease or CAD or hypertension. And here the right answer is option C, coronary artery disease or CAD. Coronary artery disease is the most common cause of heart failure. Other causes include cardiomyopathy, congenital heart defect, heart valve disease, hypertension or emphysema, etc. The main cause of glomerulonephritis: Group A, beta hemolytic streptococcal infection, staphylococcal infection, E. coli infection or Clostridium infection. And here the right answer is option A, Group A, beta hemolytic streptococcal infection. The most common cause of kidney failure is accident, type 2 diabetes, heart disease or pneumonia. The most important cause of kidney failure is type 2 diabetes. Underproduction of thyroxine leads to myxedema, Graves' disease, Cushing disease or acromegaly. Underproduction of thyroxine leads to myxedema. Deficiency of thyroxine in adults leads to a condition called tetany, cretinism, myxedema or Graves' disease. And here the right answer is option C, myxedema. Deficiency of thyroxine in adults leads to a condition called myxedema. Deficiency of thyroxine in infant and children causes cretinism that is associated with mental retardation and edema. Excessive thyroxine hormone in adults may lead to Graves' disease that is hypermetabolic state. Identify the instruments shown in the photograph. Sigel's pneumatic speculum, rhinoscope, otoscope or laryngoscope. And this instrument is otoscope. This instrument helps to visualize and examine the condition of the ear canal and ear clamp. The patient's right to refuse treatment is an example of common law, religion clause, statutory law or Nursing Council Act. The patient's right to refuse the treatment is an example of statutory law. Which ethical principle promotes the self-determination by the client, autonomy, non-malfeasance, justice or fidelity? And here the right answer is option A, autonomy. Option A, autonomy means self-determination by the client. It means let the client and significant others to determine what they wish to do. Non-malfeasance means doing no harm, and justice means treat everyone equally, and fidelity means faithfulness. 1 ounce is equal to which teaspoon? 2 teaspoon, 4 teaspoon, 5 teaspoon or 6 teaspoon? 1 ounce is equals to 6 teaspoon. So here option D is the right answer. 1 teaspoon is equal to 1 ml, 3 ml, 5 ml or 7 ml. 1 teaspoon is equal to 5 ml, 1 tablespoon is equal to 15 ml and 1 fluid ounce is equal to 30 ml. Identify vectors shown in photograph. Anopheles, Culex, Aegis or Mancunian. And this mosquito is known as Aegis mosquito. Aegis aegypti is known to transmit the dengue virus, yellow fever virus, chikungunya virus and Zika virus.
Which among the following is the responsibility of a scrub nurse in the operation theatre? Verify the informed consent, assist the surgeon in gowning and gloving, receiving the patient and maintain the count of instruments used. And here the right answer is option D, maintain the count of instruments used. In the operating room, the maintaining the count of instruments is the responsibility of scrub nurse, and all the other given options are the responsibilities of circulatory nurse. International Council for Nurses was first established in the year of 1947, 1953, 1952 or 1956. International Council for Nurses was first established in the year of 1953. Visual acuity can be assessed with ophthalmoscope, Snellen chart, goniometer or refractometer. And here the right answer is option B, Snellen chart. Visual acuity can be assessed through Snellen chart. Ophthalmoscope is used to see the inside the fungus of the eye and other structures. Goniometer is an instrument for the precise measurement of angles, especially one used to measure the angles between the faces of crystals. Which of the following blood pressure reading should be reported immediately to the physician? 130 by 98 mm of Hg, 140 by 88 mm of Hg, 110 by 70 mm of Hg or 138 by 82 mm of Hg. And here the right answer is option A, 130 by 98 mm of Hg. Among the given values, option A has the highest diastolic blood pressure. Diastolic blood pressure gives the best idea related to the risk for heart disease or stroke. Inward movement of the foot is termed as flexion, extension, pronation or supination. Inward movement of the foot is termed as pronation. Highest BMR is found in boys because their body contains thyroxine, adrenaline, testosterone or estrogen. And here the right answer is option C, testosterone. Testosterone hormone present in the males is the responsible for highest BMR in them. Patient's health is determined based upon behavior, family support, knowledge or education. Patient's health is determined based upon behavior. A low-pitched continuous gurgling sound caused by secretions in the large airways is called wheezing, rhonchi, coughing or scrygger. Rhonchi is the right answer. Wheezing is a high-pitched whistling sound made while breathing. Scrygger is a high-pitched wheezing sound caused by disrupted airflow. Lateral curvature of the spine is called as kyphosis, lordosis, scoliosis or pectus excavatum. And here the right answer is option C, scoliosis. Anterior curvature of spine is known as lordosis, posterior curvature of the spine is known as kyphosis and lateral curvature of spine is known as scoliosis. Oxygen therapy is recommended in severe respiratory distress, acute myocardial infarction, severe trauma or option D, all of the above. And here all of the above mentioned are recommended for oxygen therapy. While measuring the central venous pressure, the 0 point of the manometer is adjusted to anterior axillary line, mid axillary line, posterior axillary line or shoulder level. And here the right answer is option B, mid axillary line. 0 level of the manometer is adjusted to mid axillary line at the level of the patient's right atrium. Which of the following local anesthetic agent has shorter duration of action? Lidocaine, procaine, bupivacaine and ropivacaine. And here the right answer is option B, procaine. Procaine exerts the shorter local anesthetic action. Procaine is preferred local anesthetic agent in patients with liver disease. It is not used in this case. Father of epidemiology is John Snow, Joseph Lister, Karl Landsteiner or Robert Hooke. John Snow is the father of epidemiology. Clear out by Rookes is the literal meaning of elimination, eradication, isolation or transmission. And here the right answer is option B, eradication. Clear out by Rookes means the eradication of the disease. তো বন্ধুরা এই ছিল আমাদের আজকের ভিডিও। যারা এইমস নরসেক, RRB, ESIC, পোস্ট বেসিক और MSc এন্ট্রান্স সহ গিফটিং নার্সিং অফিসার এক্সাম ক্র্যাক করতে চাও তারা এখনই চ্যানেলটি সাবস্ক্রাইব করে বেল বাটন দিয়ে প্র্যাকটিস করতে থাকো। অ্যান্ড থ্যাংক ইউ ফর ওয়াচিং দিস ভিডিও।